Hello everyone, Dr. Kimball here. I'm going to talk to you about CrossFit and back pain. If you're a CrossFitter, a healthy person, or trying to become a healthy person, or you've got new goals to become more fit and lean, then kudos to you. I'm a runner. I believe in sustainable exercise, doing exercises you can do for the rest of your life. Personally, I don't think CrossFit fits into that category, so I'm going to give you that bias on the front end. But I've been active and healthy my whole life, and I try to stay as fit and trim as possible. So I try to do it in the context of the 6 kids and neurosurgery, and that could be tough, but it is what it is. So I watched a post the other day on Instagram about a power lifter, and he was talking about how the human disc can tolerate massive amounts of force. And all that really matters is how well your core is at stabilizing that disc. So I don't 100% disagree with it, but when you see someone as a spine surgeon, when you see a video of a big strongman type person lifting 500-600 pounds in a deadlift, it literally is soul crushing to me, because I operate on those patients. I operate on the football players, the NFL players. I operate on the weightlifters, the CrossFitters. I know exactly what happens. And the truth is, someone can be totally healthy, feeling totally fine, and then all of a sudden everything can change in an instant. You cannot control what happens to your disc when you're pressurizing it. So should you never do things that are going to pressurize the disc? No. But you might try to be a little thoughtful about how the human body was created and what forces and what activities it was meant to sustain. Was it meant to sustain lifting 500 pounds or 300 pounds, whatever it is, over and over using a barbell? I don't believe so. That's my opinion. So what I would tell you is that there's lots of activities that you can do, and there's lots of things you can do in a repetitive fashion, but the amount of weight that you're doing is the big key in my experience. So if you are CrossFitting, you would probably end up getting into the culture of lifting more, doing more, cleaning and jerking, deadlifting, and all those things, these hyperkinetic, heavy maneuvers that put a tremendous amount of pressure on this disc and the annulus. Regardless of how fit your core is, regardless of how fit your low back muscles and your stomach muscles are, that doesn't change the fabric of the annulus, which is really the most vital component to keeping the disc healthy. It can tear if you have a little asymmetric distribution of your weight. If you overweight your spine, it can tear. The muscles, which don't necessarily connect directly to the disc but connect to the spine, aren't going to help the annulus be stronger. They will help stabilize and keep the spine straight. But if your spine is a little bit off, the vectors and the forces that are being applied to that disc are super unpredictable. I've seen patients herniate discs stepping off of a sidewalk. I've seen them herniate discs jumping out of the back of a truck. Most people will herniate a disc and not even know what they did or how they did it. They just wake up one day and it starts with back pain, and then it starts going down the leg. So if that is the case, and it can be super disruptive to your life to have a disc herniation and this kind of a failure in your human body, why would you put that much weight and stress on your spine in an activity that you know one day you're going to have to stop? So I would caution you with doing too much weight. How much is too much weight? I'm not going to tell you what that is. For me, it might be deadlifting under 70 to 100 pounds, and it might be doing very high repetition. I recommend doing reps up into the 20s plus. If you're not doing that kind of repetition, I think doing 1 to 3 reps is completely detrimental and damaging to the spine. I would highly recommend against it. So you can find CrossFit gyms where they'll support you in this stuff. If you can't, go find somewhere else to work out. You don't need it, and you don't want to hurt your spine. It's not worth it. Trust me. I'm a spine surgeon. I do this surgery every day. I would never do that to my spine. So take it for what it's worth.